Hello, I'm Dr. Kenneth Neufeld, and I'd like to briefly go through some post-operative instructions. Following these instructions will help expedite your recovery and ensure that you heal as quickly as possible. This video will pertain to eyelid surgery. Procedures that will be applicable are blepharoplasty or eyelid surgery, ptosis repair or droopy eyelid, entropion or ectropion, which is an inturning or an outturning of the eyelids, skin cancer reconstruction after Mohs surgery, or any other type of eyelid procedure. There are a few things that you will need to do as diligently as possible immediately after surgery. If you are sent home from the operating room with an eye patch on your eye, leave it on until you are told to take it off and begin these instructions immediately afterwards. First, keep your head elevated for the next 3 days. This is important to help your body process swelling. You can either sleep with a few extra pillows, or if you have a recliner, it would be helpful for you to sleep in that for the first 3 days. Ice compresses are imperative to your healing. Ice compresses should be applied for 30 minutes on, followed by a 30-minute break. A bag of frozen peas works great as it can conform to your face easily. A Ziploc bag with some ice and water will also work, as will a variety of commercially available ice compresses. It's important to put a barrier between your skin and the ice so as to not irritate your skin. A paper towel will work just fine. You do not need to use the ice while sleeping. After day number 3, change to warm compresses. You can use a wet towel microwave for about 20 seconds, but make sure to test it that it's not too hot. It should be warm, not hot. There are also numerous commercially available products to use as well. If antibiotic was prescribed, it will likely have been called into your pharmacy. This ointment should be applied to the sutures 3 times per day. It can be applied with a Q-tip or a clean finger will work just fine. You don't need much, only about ½ an inch is needed to cover the sutures on one eyelid. There will be several refills available to you if you run out. Continue this until I see you in the office unless you are told otherwise. It's important to know that this ointment will cause your vision to be blurry. This is normal and is not harmful at all. If your skin becomes red, itchy, and more irritated after you use the ointment, please call us as you may be having an allergic reaction. If eye drops were prescribed, put 1 drop in the operative eye or in both eyes if both were operated on. Usually drops will be needed for procedures done on the eyeball itself or for a lower eyelid blepharoplasty. Use these 3 times per day until I see you in the office. You will be prescribed a painkiller in case you have moderate to severe pain. It is unlikely that you'll have much pain at all. If the discomfort is mild, you can try to take your regular dose of Tylenol. If the discomfort is not resolved with Tylenol alone, you can take the prescribed pain medication, but do not take both at the same time. The pain prescription can cause nausea and constipation, so please plan accordingly. You can wash your hair and face the day after surgery. Be very careful and extremely gentle around the operative area. Let the water run down and gently pat dry, and do not scrub aggressively. Do not wear makeup around the operative area for 2 weeks. This will help decrease the risk of infection and permanent discoloration of the skin. Some oozing of blood from the wound is very normal after surgery. The small vessels are coagulated during surgery, and these sometimes open up afterwards. If this happens, do not panic. Light pressure with a clean cloth will usually be enough to stop it. If there should be excessive bleeding, extreme pressure, or a loss of vision, please call us immediately. If you're taking eye drops for glaucoma, continue them as you normally take them. If you had been taking aspirin on a regular basis, you will likely have stopped this before surgery. Unless you're told otherwise, continue to hold this for a week after surgery. Due to the sedation you are given in the operating room, please do not drive or make any important decisions for at least 24 hours after surgery. In terms of your activity, just take it easy. No strenuous activity or heavy workouts for the first 2 weeks, as this will help your healing be as quick as possible. Be sure to take a multivitamin and eat some extra pineapple. Pineapple has bromelain in it, and this can be helpful with expediting healing. Overall, your recovery should be rather uneventful if you can follow these instructions as much as possible. We're here for you to answer any questions should you have. Our number is 844-ATL-RENEW. 844-ATL-RENEW. Thanks for watching.